This has been, in fact, a bit controversial over the last few months, mostly around the last 6 weeks, in fact. And just washing your groceries, any kind of fresh food that you buy, that you put before you put it in the refrigerator, wash it. Is probably most important. And if there's anything non-fresh or other things that you would immediately use, sanitizing those would be fine. But if you want to stack them away for a few days, then it's not necessary to do. To answer this in more detail, it really will depend on what your extracurricular activities, specifically schools, will look like. If you have a Hebrew school that is going to implement all the safety measures that are currently being recommended, whether this is by our document or public health, to some degree they are all very, very similar. Then it's probably safe to send the children to a Hebrew school, but you need to assess this with your individual schools and to ensure that all these layers are really in place. So I think, thank you for the opportunity to elaborate a little bit more on the two papers that were recently published around demonstrating a high viral load in children. I think the two major issues with these papers are, number one, viral load in itself doesn't equal transmission. In fact, we do know from adults who had lower viral load who were able to spread the virus. So I think the interpretation of these papers, extrapolating from high viral load of children to high transmittability at this point is wrong. I think it is important also to recognize that, at least in the one paper, the comparison that was made was a symptomatic child within the first 2 days of infection, comparing those viral loads to adults who have already been in the hospital for 7 days. We do know that the viral load concentration at the beginning of an infection, in fact, even if people are pre-symptomatic or asymptomatic, are the highest. So again, I think that just speaks to the fact that we need to be careful in our interpretation. And in fact, the senior author of the JAMA paper has come out to correct some of the interpretation of this paper. Now, what I think is very important, though, to emphasize, number one, kids can and will transmit. What has led to so much controversy over the last few months is that we expect the children to transmit the coronavirus to the same degree like they transmit other viruses, for example, the flu or the common cold virus. And we now have lots and lots of small studies that suggest that the younger children, in particular the ones who are below the age of 10, may just not transmit at that degree. It's very important. It's not that they don't transmit, but they may not transmit at that degree. And that makes everyone in the medical scientific field somewhat uncomfortable, because it's against everything that we think we understand when it comes to respiratory droplet viruses. At the moment, I think the most safe statement to make is children will transmit. They may not transmit. The younger children may not transmit to the degree like we would expect them to do. And we haven't seen young children being the driver of high community transmission yet. All of this is as of today, August 27th, 2020, and this may still change if we see masses of children all over the world going back to school this fall. So it will be constantly reassessed, and I promise if anything substantially changes, we'll provide an update to our own community as much as we will provide an update to the scientific community. I actually do not know the answer to what specific units are being used. This is really within the territory of engineers who have been working with governments, not just in Ontario and Canada, but really all across the world. I do want to point out one important finding, though, here is some of these portable ventilation units that have certain filters in them, in itself, there won't be sufficient. So if we are looking at schools, particularly some of the schools that unfortunately have classrooms with no windows, it will have to be the combination of the general ventilation system plus some of these portable ventilation systems that could provide some added benefit. I know that all of the schools in Ontario are currently working very closely with their boards, as well as with the Ministry of Education, trying to find out where are these particularly vulnerable schools that need support with ventilation. And just as of yesterday, there has been more money provided to these schools to really improve ventilation as best and as fast as possible. So I don't know exactly how this is going to unfold, but what I can tell you is the following. Number one, I think at the beginning, we will be testing a lot of children with just regular runny noses. And what we have been discussing among the pediatric community with our primary care physicians is to really try to look at COVID testing over time in the context of community transmission. If you are a child with a runny nose in an area that has very low community transmission, and you are within your own family careful with bubbling in terms of really keeping a very close social circle, the likelihood that this child's going to have COVID is extremely low. As of yesterday, Ontario Public Health has provided a few guidelines for schools, mainly around when should you get tested and what's the testing tracing strategy going to look like, and you can look that up on the website. But undoubtedly, there will be a lot of COVID-19 testing in the beginning, and then we will probably try to really reassess it as much as possible. We will try to do that at the beginning. But I mean, realistically speaking, we will be looking at a lot of children getting tested. The question around taking time off from work is a problem. And I do think that every employer in our province has to be as flexible as possible, because we will see children stay home much more often than we have ever seen before if we do this right. I think, again, the risk for this is going to be big in two scenarios. Number one will be high in the beginning because everybody is going to be nervous to see how this is all going to unfold, and it's going to be extra careful. And then if we are going to see an uptick in community transmission throughout the fall and or winter, we will probably be seeing more children stay at home, and we have to kind of see how the sector of employers is going to react to this. But what is going to be critically important is to be as supportive and flexible for working parents who have children who need to stay home until they are cleared to go back to school. But I recognize that this will be a challenge. So if you go back to the official public health guidelines around wearing masks, from an official guidance point of view, it is clearly stated that if you have any kind of medical reason that prohibits or prevents you from wearing a mask, then you don't have to wear a mask. So I don't think there will ever be a situation in a school where anybody will request for a child to wear a mask if they have, from a developmental point of view or some other medical reasons, difficulties, or are not able to do so. What I think is going to be critical in situations like this is that teachers as a community, together with the other students, depending on what the age of the student is try to make sure that this child in itself is not going to feel isolated and is being looked upon in a, let's call, critical way. These are a lot of concerns that many of the children we see at Sick Kids, for example, with complex medical conditions have. These children are already, to begin with, different. And if some of those now are not able to wear a mask, that could be particularly challenging. And I think that is something that teachers and special education teachers and assistants have to try to mitigate as much as possible, that these children are not going to feel more isolated than before. I do think that all the special education teachers, like all the other teachers, will wear masks, and if they really are in close contact with children, many of them may even wear a face mask or a face shield. So I think what's critical here is that we go back to what I said during the webinar. The masks are not the all and be all. The masks are not what is going to decide whether a child's going to get infected or not. We need to make sure that we, in case of a child in particular where you cannot wear a mask, implement all these other sanitary guidelines like hand washing, cleaning, and so on. Just because you have to work with a child that cannot wear a mask, that doesn't mean that you will get COVID immediately. So I think it's, again, coming back to the main message, having the bundled measures in place, while the risk might be a little bit higher with a child not being able to wear a mask, it still can be mitigated to quite some degree if all the other measures are in place. I think that testing strategy, as well as the testing methodology, will evolve hopefully sooner rather than later. What that means is the following. I think there are now a number of studies that have shown that you don't have to do a full nasal pharyngeal swab, and you can just do a nasal or throat swab, which is almost as sensitive as the other test, but significantly more comfortable. There are also now a number of saliva tests that have received FDA emergency authorization. And I can assure you that there's a lot of advocacy from individuals from the healthcare sector currently happening with Health Canada to bring these tests to Canada, as they will help significantly, not just with testing of children who have symptoms and are teachers, but they will probably also hugely help with surveillance testing, where you just go and do random testing of lots and lots of children and our teachers. So I think this will develop fairly quickly. It won't be ready by, I don't think we will have these tests by September 8th, but hopefully within the next few weeks. The truth of the matter is parents cannot socially distance from their kids, nor should they. And I think this all comes back to, no matter how much guidelines we are giving for the general public, that addresses 2 million students and obviously all the family members. It comes down to a very individual decision and individual assessment of risk. It could very well be that you as a parent, or one of you as a parent, maybe are at higher risk for complications from COVID and or having severe symptoms from COVID. So your risk assessment strategy of balancing the risk of sending a child to school versus keeping a child at home is very different than from others. And at the end of the day, it is your individual decision, and whatever works for you is the right decision. I know that I have been personally very vocal, and many of my colleagues have been vocal, that it is critical for children to go back to school in class. And by and large, on a population level, that's entirely true. But there are several individual family situations where this might not be true. And while we have lots and lots of data, for example, on children who have really suffered from the isolation with mental health conditions or amplification of mental health problems the children before COVID, there are a few individuals children who have actually done quite well with online learning. So at the end of the day, and conduct it in a way that come to a decision you can feel good about. And then it's going to be the right decision, whatever. So I think at the end of the day, the ideal setup for any kind of classroom is that children are at least 1 meter away for the younger children and 2 meters apart for the older children. That's the perfect scenario. There has been a lot of discussion more recently, as I've heard from schools, about outdoor classes. And I think there are some topics that can and should be probably considered to be taught outside. Some other teachers, interestingly, mostly the science teachers, feel that that's probably not as adequate. I have to tell you, though, as I've been speaking to lots and lots of parents and teachers over the last few weeks, there are some enormously creative teachers out there who come up with creative solutions that many of us have never thought about. Just yesterday, I was sent a picture from a teacher who has round tables in a kindergarten class where children sit around. And obviously there is no distance whatsoever. So what this teacher created is lots and lots of plexiglasses so that the children have almost like a cubicle, an umbrella on top of it. And it looks like a fun table to sit at, or like a fun desk to sit at. So I think there are enormously creative solutions out there, and I have to give credit to some of the teachers I've been speaking to who recognize that the realities are many classrooms will not be able to accommodate 1 or 2 meters of distance depending on the age of the child. But again, coming back to what I said earlier, each one of you need to speak to your schools and see what your school is able to do within a classroom. How is the classroom going to look like? All the schools should and will, I think, provide you the information of how it looks like, and that will help you in the decision making of whether or not you want to send your child. So the Ministry of Education has set aside funding for, it was initially announced as each week 10% of high school students will be randomly tested within the province. I think that's being revisited a little bit to have a much more targeted approach of surveillance testing, particularly in areas where the community transmission, although it's overall pretty low right now, but there are some areas where it's higher than in others. where these surveillance tests will happen, and maybe not just only in high school students, but also in other students and teachers and school staff. So the final decision of this is probably going to be made within the next 7 to 10 days. But there will be some surveillance testing, and I think that's in fact something that is a very good idea. And I think we are currently the only province who are trying to think about what type of surveillance testing might be most informative. Truth of the matter is that this is going to come down to what I've been saying over and over, and you hear all the time, is the community transmission. If you live in an area and the children who visit the classroom live in an area of low community transmission, then the risk of either getting COVID in preschool or transmitting COVID is going to be very low. I can tell you right now that the highest risk here will be the teachers bringing it into schools as adults. So getting me back to make smart decisions as an individual adult about what you do and what you don't do. Again, the lower the community transmission is, the lower the risk of infection is. But I do think that grandparents need to be more careful. It also depends on the age of your child, which school does your child go to, what are the social interactions of your child. But I do think there's more thought that has to be given to grandparents, for sure. That's not to say that you shouldn't see your grandchildren. I want to clarify this. It's probably more about the closeness and the physical contact. You can absolutely see your grandchildren. You just need to be probably a bit more careful with close contact depending on the circumstances. From a population or public health perspective, physical distancing and masking and hand washing will be in place until we have a vaccine. And the individual decisions you can and should make in your own personal life with your bubbles and so on, that will depend on the individual circumstances. But from a general point of view, I think we'll be living like this. I think you can participate in a carpool if everybody's going to wear a mask in the car. And if you make sure that people wash their hands before they come into the car, and depending on the age of the children, you may want to clean the car a little bit if you have little children in the car. Otherwise, you can probably still do the carpool. So I'm actually grateful for this question. You may remember that I made a comment during the initial webinar about expressing my frustration about how much the current discussion is not only politicized, but is kind of filled with anger and hatred that has escalated the anxiety in our community to really unacceptable levels. And that is, and when I say this, it's in part related to this question. Even without this increased level of anxiety, the amount of guilt that individuals have when they get infected, or the amount of concern that individuals have if they get infected about potentially exposing family members or colleagues, is real. I have seen it in our hospital. And right now, this is just being escalated. If you will see a case like this in school, whether it's a teacher or a child, it will be a significant issue to deal with. And truth of the matter is, it's not going to be anyone's fault. There will be a lot of conversation that will have to happen either in your own home or between the teachers and the students to make sure that it's not anyone's fault if you actually get COVID-19. When we talk about we won't be able to eliminate the risk, then that's a real statement. Yes, we can safely open school and mitigate the risk, but there will be cases in schools, no matter how much we are trying. It's not going to be impossible to completely eliminate the risk. And if we could internalize this, then I think it would be much easier to deal with the situations that will undoubtedly occur. And they're not to be seen as a failure of a school not doing good enough necessarily, or you necessarily doing something wrong in your personal life. These cases will happen, and it's okay. But I think these are going to be challenging discussions that you will have either at home or with the school, and we need to be prepared for this. I have received lots of emails, angry emails from teachers or parents telling me what's the mental health status of my child going to be if their teacher dies. Is it going to be a problem? Of course it's going to be a problem. But I think we need to keep it in perspective that hopefully the cases will be very low, and also hopefully that we don't see any catastrophic events in children and our teachers. Mostly the teachers is the group I'm concerned about. And these will be discussions that we will be having for sure. And they will be difficult. I know it because we have lived it in our own institution. Try to address the issue of the chronic impact of COVID-19 in general first. As unsettling as it is, we just don't know the answer to this. This virus is a virus that has been around in humans just since November of last year. It has been around in North America only since, people don't know whether it's January or February, but en masse, it hasn't been around since March. So we are looking at a disease that we have not known until March, or let's say January, which means we have known this disease for about 9 months now, or 8 months. So any kind of speculation about what the chronic impact of people who get severely ill from this is going to have is what we know today, which is very little. I do think we need to be very careful about distinguishing some of the reports from older individuals who take a long, long time to recover. And again, translating this into they will have symptoms for the rest of their lives. We just don't know that. We just simply don't know that. And I think it would be wrong to assume that that's going to be the case. Is there a concern that we have as a medical community where some individuals who had severe COVID-19 with multiple different organs involved may struggle for the rest of their lives? For sure. And all these patients will get very close observation and surveillance for quite some time. Now, for children, that question is even more challenging because we have had very little children infected with the virus to begin with because most children have been isolated. Then the children who do get infected are either completely asymptomatic or have very mild symptoms and don't get really sick. We do know about this potential association, or let it even call a likely association between getting infected with the coronavirus and then 4 to 6 weeks after that infection, getting this multi-system inflammatory syndrome. And there are some very, very few cases around the world where this has impacted the heart in a way where our colleagues are concerned whether these are potentially chronic conditions that a child will have to deal with. By and large, it's still very rare. And when you see a child, it can be treated and these children improve. Now, hypothetically speaking, in the question that was asked, could it in theory be that children are infected asymptomatic with the virus, don't have any symptoms, and then years down the road, we learn about the potential impact of ever having been infected with COVID-19, and then years later having some medical complications related to this? I think based on what we know from other viruses, it's extremely unlikely, but we just don't know. The truth of the matter is we will only know this in years to come. So again, we are faced with this unsettling situation in our life that everything we do and think about is a balancing strategy and thought process of mitigating risks. I mean, we can't isolate our kids, as a matter of fact, ourselves for years until we know whether there are any potential long-term consequences of this virus. What we know today is that there's a subset of adults who have had multi-organ severe disease. There are some concerns that there might be chronic medical problems as time goes on, but we actually don't know that. How can we? So I think it's really important that you have open communications within your family, whether this is with brothers, sisters, husband, wife, and with your children if you can, if they're old enough. And maybe try to stay away from social media and some of these outlets that are creating just an unreasonable amount of anxiety, which will help you then to put things in perspective. Talk it through amongst yourself, with your children. And I think if you can do that, and if you're willing to do it in a very open way, then you will derive at the best solution for your family. There are a few parents I've spoken to personally, even though they acknowledged you have reduced my anxiety by putting things in perspective, I'm still so anxious that I don't think I can send my child to school. So I think it is very important that you try to have open communications in a rational way. Speak about the facts you know, speak about the facts you can read about, and don't let this conversation be deterred by some of the noise that's currently happening on social media and sometimes even in the regular media. Ontario Public Health has a website where they report their daily cases, including which areas these cases are coming from. And you can go to that website. In addition to that, the Ministry of Health is on that website publishing very clear numbers on a daily basis also as it relates to tests. So just go to their website, it's all there.